Innovation can be lonely. I was truly inspired by Jonathan Gray at APEC Forum 2015, where he shared that we can be stronger together. On the sites of that same forum, I met Joran Hendricks, who gifted us the idea of co-learning. Chechai from Siriraj Hospital tells us that healthcare can be faster, better, cheaper, safer, and happier. Over the course of the last 1 to 2 years, we met with many like-minded partners from overseas as well as from here in Singapore. And we have come together to make a difference in healthcare from the ground up. To quote my favorite movie, that you are here, that life exists, and identity, and the powerful play goes on, and that you may contribute a verse. Welcome to CHI.
We've known that all along, if we do the same thing over and over again, healthcare cannot be sustained in its current model. So transformation appeals to many of us. And when you use a word as strong and as powerful as transformation, you know you can't do it alone.
Being in this environment, in this network, actually helps us better connect to the users and to the industry and looking at what are really the needs. This is really where I see the convergence of interests and how we are able to synergize and work better together.
Often we will innovate for very practical reasons, productivity, increasing safety, the usual better, safer, cheaper, faster healthcare. Patients and the community are looking for better health, and what we can bring to them is better direct value to their lives with innovation.
We believe that our efforts might be of interest to other institutions. We are certainly very interested in learning from the experiences of other institutions as we find better ways to look after our patients. When it comes to better care and safer care, we are all partners. We're all on the same side.
Are working towards a new model of healthcare where patients can receive more care at home and in the community, and to create a healthier population. If the CHI members can contribute to making this happen, we would be very proud of this achievement.
And this is what we hope to bring to the CHI network, to be able to help them understand the users, the patients, the caregivers in a very user-centric way, such that we can build a comprehensive and inclusive healthcare network.
Any future that we see for the Singapore healthcare system must be driven by our people, our workforce. And that is why I think this CHI co-learning network is a very important start, because it's an investment in the learning and development of our future healthcare leaders. And this will in turn influence the type of the healthcare system that we as all Singaporeans hope to get for ourselves and our children.
I think clearly the days of manpower-driven growth is over. And the only way for industries to continue to thrive and survive in Singapore is really to relook at their processes and adopt new technology, think of how to be more productive and how to rely less on manpower, be more manpower lean.
We have created our own knowledge or our own experience, especially in R2R and the lean application to healthcare. But we still eager to learn and to share our knowledge and experience. We want to learn from other institutes about what they are going on, what they think, the way to improve, especially on the workforce.
We see the CHI network as a powerful vehicle to bring together the healthcare players regionally and internationally and connecting them with the industries here in Singapore. We hope to see the opportunity to develop innovations around in the areas of standards, best practices, and even product innovations that could come out in the time to come.
The network represents, I think in my mind, two things. One is actually it's like a big community of practice. It has got expertise where we can learn so much from each other, and also tap into each other's brains, the experiences that they have, and perhaps even organize joint learning together. With all these partners together in the same room, real change can happen, where we can drive healthcare further, better. This is a group of people who can actually work together and make things happen.
Partnership within the co-learning network will be able to share and learn from each other through the joint training activity, active exchange of our staff, and provide accessibility for coaching and mentoring within our network to promote leadership and managerial capability.
As we sharpen our understanding on the needs and on what's trending in the healthcare field, we can continually refine our curriculum for pre-employment training and for continuing education and training for practicing professionals. This partnership with CHI will lead the way forward in creating more innovative solutions to address the range of challenges in the healthcare sector.
The membership will allow us to interact and exchange ideas with thought leaders in the network. This is important because it helps us to develop a deep understanding of the future needs of the healthcare sector. And this will then in turn allow us to update our curriculum so that we can inculcate the relevant technical and soft skills in our students.
I firmly believe in the open source concept. The developers made the source code available to users to be able to improve it themselves. I think in healthcare, open source would mean that patients and the community who are on one side of the fence can now come and join us in this journey together. They can look into how we work, examine our processes, look at our outcomes, and even in the sensitive areas, work together with us to improve care.
The modernization of care is so challenging now that we need to find ways to shorten the way between the idea and the execution. This network has many valuable centers involved, so we hope that we can energize each other to new levels of understanding.
That there's always the advantage of the academic working with practice colleagues alongside with the people who are on the ground, and to really understand the issues on the ground, and then explore innovative ways to make the processes better.
In Singapore, healthcare is complex. We have to grapple with an aging population, we have to grapple with a shrinking workforce, and we have to grapple with rising public expectations for better and better care, but at a cheaper and cheaper rate. And in this very complex environment, coming together would help us to accelerate our learning.
I think it's very important for the council members to actually share good ideas across different institutions, and in that sense, we don't actually duplicate a lot of the good effort that's been ongoing.
The strength of a network like CHI is really the numbers of partners and also the real projects that we actually do together. There will be wonderful opportunities for us to extract lessons and apply it to the community-based providers that we partner with.
This, emphasis on co-learning is very key because, everybody comes to the table as equals, right, in order to solve a problem. And in innovating solutions together, we can also learn, of the nuances and of the real problems that public healthcare as well as the partners in healthcare face.
And by sharing our best practices, we can elevate the standards of care and healthcare services across the region, across Singapore, and lift up our ability to educate our patients, to educate our students, and to educate our healthcare professionals one quantum level higher.
And I hope the impact that the CHI can make are the type of impact that we can look back and say that would not have been possible if it's only attempted by one individual organization. But it is possible because it requires a multidisciplinary approach. And it was a complex problem that only organizations as diverse as CHI could tackle comprehensively.
I think individually we've tackled many challenges, but there are some huge challenges that we can only tackle together. So I'm really excited about being part of the team with you. Our organization, my entire team, are in there as part of our unique collaboration.
The greatest impact of the network would be to disrupt the way we work, the way we think, to keep us nimble, current, and future ready. This network will provide means to benchmark, means to co-learn, co-create, and co-develop better processes when the community and the patient can care for themselves. And if the network can offer us ways to walk this journey, it would be great.